everyone and welcome to KYE Talks. I am Sonal Ambekar, your host for this interview. Know Your Entrepreneur is a digital platform where we talk to several entrepreneurs who tell us why they chose not to be stuck to the regular 9 to 5, but they went ahead and did something different. They went ahead and chased their passion. One such entrepreneur, or must I say, one such doctor who's contributing a lot to our society. Our guest today is Dr. Prabhavathi Durai. She is a master's in physiotherapy, elective in neurology. She started as an academician and with time she started practicing physiotherapy herself. She has successfully treated more than 3,000 patients and changed their lives. Since 10 years, Prabha Physio Care and Wellness Clinic has shown major contribution in pain management for degenerative conditions, fracture management, arthritis pain, delayed milestones, causes, post-surgical cases, etc. Let's get to know more about Dr. Prabhavathi. Hello, Dr. Prabhavathi. Welcome to KYE Talks.
Thanks for the nice introduction, Sonal. I'm very happy to be here.
Thank you, ma'am. So, tell us how did your journey begin? You were an academician before, and then what motivated you to start your own practice and start your own clinic?
Okay. I'm Dr. Prabhavathi, neurological physiotherapy expert with 2 decades of experience. I'm a mother of a naughty boy, a techie son, and I'm a wife of a superhero who's an IT guy. Then I'm a founder and director of Prabha Physio Care and Wellness Clinic, and I'm leading it successfully for more than 10 years.
Wow.
I speak well, I communicate well. So in teaching, it was quite okay. I've started my career after completing my master's. I worked in Bangalore. There I've started my career in lecturer, then I immediately promoted to assistant professor, then associate professor. Then I was registered as a PG guide in Rajiv Gandhi Health University, wow, in Bangalore itself. There I worked for more than 4 years. Then I got a call from my own college, Annamala University, where I was called for a research work, which is funded by US project Sanofi Sevenths for a research on spinal cord injury. So there I worked. I was also trained how to do a specific examination because it should have uniformity in examination. And okay, so I was trained there for that. Then after that, it went well. Again, I joined in the same college. So it all went well. Then I got married and shifted to Chennai. Then once it is in 2007, I came to Chennai. Then I worked in Chettinad for 2 years. And then I've started my own clinic, Prabha Physiotherapy, Prabha Physio Care and Wellness Clinic.
Right.
It was almost 10 years now completed. More than 3,000 people I have attended.
Wonderful.
Like I approach all the patients with holistic and give all the therapy on evidence-based. Okay. So we'll analyze up to the root cause what we are giving and give them best possible and give them 100% recovery in possible areas.
Right. Ma'am, like you mentioned that your elective is neurology, and like you mentioned that you've done research on spinal cord injuries and all of that, and I'm sure most of us watching this video or watching this interview must know that spinal cord injuries are usually the most difficult ones to recover from, and the work that you're doing, helping so many people get back on their feet and lead a much normal life, instead of sitting back with their injury. That's wonderful. That's kind. It's very kind of you.
No, actually, Sonal, that was a research work where it was a drug. They wanted to find out how this drug was going to be useful for some people for recovery. Now I'm not connected with it, but that period for around 11 months, I was in that project. I was trained, I was coordinating, everything went. Okay. It was a good experience and it was nice being in that component also.
Okay. So I'd like to ask you, what gives you a sense of accomplishment? I mean, what gets you going every morning that you want to go and you want to achieve this today? What is something that you achieve on a regular basis?
Yeah, see, always in my mind, I have a driving force to run daily, because see, even if I record one patient today and I see some smile in that face, That's it. The whole day is nice for me because
Wonderful.
I'm making somebody
Happy.
to come out of their pain and make them to do their daily activities, which is very nice as a human because I'm contributing for others. I'm helping others to go back to their normal, and I become an important page of their histories. When they write it, I'll be there.
Yeah, you will be there. You will be a part of so many
those
stories.
Things really drives me. Those things really
Wonderful, wonderful. So, ma'am, as you mentioned that you went from being an academician to starting your own practice. Every person has their share of ups and downs, barriers and obstacles. You must have faced some. What were those barriers and how did you overcome them?
No, generally, when a woman is doing an entrepreneur, there will be quite a lot of obstacles. Okay, first we have to show some courageousness to do it. Yes, courage. You have to sit up to 8:39 in the night, so you need a courage. Second, when you are doing expertise, you have to show that in a result, yes, I'm making it, and I have to get their faith within first day itself. Okay, or else I have to sit and explain how it is going on. Every area, see, even to get a job done, see, it is not an easy component to run an entrepreneur, that too by women. I have to get jobs done by others. For that, how to talk, how to negotiate, how to make it to next level. Every phases there was a struggle.
So, ma'am, you mentioned that that you have a child, a naughty boy, you said. And it must have been difficult to take care of your little baby, and then your clinic is also your baby. That is what an enterprise is to an entrepreneur. It's a baby. So you had to take care of both the babies. So how was it looking after both of them?
No, initially I planned like this. See, the clinic number of patients was little less, so I could able to manage. And meanwhile, I'll take my son also there, so people will also accept him. There was not that much problem because most of them are old people. Most of them, so they'll consider him as their own grandson. So it was so nice. Even for one patient, he was helping me to show like, okay, when I say raise your hands, he'll raise. So it was also making them to see that and do it, and it was fun doing it. Like
he was doing a little bit of cheer in their sessions. He was putting that cheer in their sessions. Wonderful.
It was
wonderful. So, ma'am, what would you say are the factors that you think will help you achieve your business aspirations going ahead?
No, see, for anybody to reach some extent, you should have some goals. It should be big, audacious goals or a set goals to a higher level. And you should have a vision statement and mission statement, plan it nicely, have a defined component on it, then you can reach it.
Wonderful. So, I would like to ask you, how has being an academician then changing into, going to starting your own practice? It must have been a shift. It must have been a shift. And usually these are journeys. Journeys do change us sometimes. They have such effect on us. So how would you say that this journey has changed you as a person?
No, actually, where I studied, Annamalai University, Rajiv Gandhi Medical College. Okay, it is Raja Muthiah Medical College and University. It is now addressed as Annamalai University, where it will be loaded with many varieties of patients. So for me, handling patients is not a tough task because on daily basis we'll be handling patients in a like so many numbers. So for me, handling a patient was quite comfortable. Even while teaching itself, we'll be demonstrating to the students how to handle people with pains, all that. So every area I was doing in a different way, but still I was in a contact with people. Okay. So, but from academician to an entrepreneur, I have to prepare myself. Like, say, okay, Prabhavathi, you're going like this. So you need a mental preparation for that. I was doing a workout inside of me. Okay, it is an entrepreneur. You have to identify a place and you have to meet all the people.
You have to do a lot of things.
It has so many components. So I was planning earlier, like, okay, this is all I have to do, this is all I have to do. But luckily, everywhere I was blessed with that component went well, because it was supported by my husband and everywhere. There was struggle. See, without struggle, you will not move on.
There's no success.
You will not move on. But it was quite okay. I was little slowly moving ahead with it. It was tough too, because your mindset should change. There you will not have any responsibility. Only have to sit, prepare a topic, explain in a detail. If they give a result, that's it. But here, it's a different, total different component where my result should be different. I should satisfy the patient. I have to get the trustworthy component. So many, it's a very different journey. Little I was preparing back. Every day I'll go with that same spirit. Okay, you first patient, how you address the same kind all the patient every day. See, when it is first patient, you will have some enthusiasm inside. You need a result, so you will give 100%. The same 100% I target every day on all patients.
Right. And that it's also important that sometimes the patient themselves are mentally and emotionally so much in pain because of their injury. Not just physically, but they also have that mental and emotional trauma, that they're going through something so painful that they need someone, they need at least their doctor to be cheerful and enthusiastic, so they can believe in themselves. Oh yes, they can do it. So it's very important for, when the doctor is very cheerful or very encouraging, the patient themselves feel like, yes, they can do it. They can push themselves a little and they can, reach their recovery faster. That's wonderful. And talking to you, I can tell that I'm sure your patients must be really happy with, your hospitality.
Yes. No, see, here in my clinic, I'll give a personal care. That is why they're attached. Whomever comes here, they give a mouth references and they'll bring their family members to me only. That is it. And second is, always I give importance in educating their problems, how to prevent it. See, prevention plays a major role for all the patients. So like that it is. So I have repeated patients on a different issues, or they will refer patients, like that only it was. You can see my reviews in Google.
It's all word of mouth, basically. It's not publicity over social media. It's people coming and experiencing that good service from you, and then going and referring you to people. That's wonderful, ma'am. So moving on to our last question. What would be your message? What would be your words of wisdom for budding entrepreneurs out there who have the capability, but they are too scared to take the risk, to take the first step? So how would you encourage them in your own message?
First thing is, are they having burning desire? See, it should be a burning desire. It should not make them to sleep. Okay. First is that, do you have that burning desire? Then you move on. Second is, always believe on yourself. Your self-belief only can motivate you to next level. Third is, prepare your skill needed for it. Like what is the area where you are going for it? Prepare a skill. Always be a quick learner. Learning should be there at any moment. Still I'm learning. So up to an end, you have to be learning should be a process always.
Yeah, wonderful. Thank you so much for coming here on KYE Talks and sharing your journey with us, ma'am.
Okay. Thank you. Thank you for the opportunity given to me, Sonal and KYE.
Our pleasure, ma'am.